And with those COVID cases exploding like we've never seen before, let's talk about all of it with Newsy health and science reporter Lindsay Thies. She's live in San Francisco. Lindsay, the numbers are overwhelming. They are staggering. There is a dark sense of deja vu to what we're going through right now. In the middle of that, some new guidelines from the CDC today about quarantine and masks. What is the latest on that evolving guidance?
Yeah, and the CDC guidance is, quite frankly, pretty convoluted and can be confusing. So let's talk about some of these changes, Rob. This new CDC guidance change now suggests that people who test positive for COVID but don't feel symptoms should have a negative test along with 5 days of isolation period before they return to work or school or their life outside of isolating at home. Specifically, the suggestion is that the test should be an antigen test and it should be taken towards the end of those 5 days. CDC guidance now also says that people should continue to wear a well-fitting mask around the home and in public for 5 additional days after that isolation period, days 6 to 10, if you will, and add that if you cannot mask those days, you should continue to isolate for a full 10. Now, this comes after just last week when the CDC had switched their suggestion of a 10-day isolation period to half of that, and many health experts then and all the way up until now have continued to be very critical about that. The new CDC guidance also out this evening said that cloth masks are okay if they fit well and filter the air properly. Several health experts have said in recent days that cloth masks do not provide good enough protection. And frankly, we've been reporting on this since May of 2020 about research that has shown that those cloth masks don't do a great job of blocking those particles. Here's some more from today's White House press briefing with Press Secretary Jen Psaki about the CDC guidance.
They are just continuing to assess every day, every week, what information they can update on based on the science. And sometimes that means changing recommendations, that means adding to recommendations, but that's what happens when you lead with the data and the science and not lead with a clear communications plan.
So let's talk a little about the science that the CDC is citing behind that why to try to clear up that confusion on their end. The CDC is saying that their latest data suggests that with Omicron, that spread is happening 1 to 2 days before someone shows symptoms and those 2 to 3 days afterward. But this is still a lot with these changes this evening to sift through, and it's really adding stress to worry at a time, Rob, where we are seeing cases just exponentially grow with this record 1 million plus new cases on Monday, Rob.
No, it's a hard number to get your head around for sure. And it should be noted, though, it is a little strange to see the CDC change its guidance after backlash as opposed to evolving science. I know what they're saying, but if there wasn't this backlash, you have to wonder whether they would have updated this. But, you know, we'll see how that continues to evolve. Also tonight, the CDC has shared some new data about how contagious Omicron is compared to Delta. So the emerging narrative right now is that it's not as severe, but it does spread more rapidly. So what does all that mean for people in real time beyond all the numbers? Because some people say we should be paying attention to hospitalizations, not necessarily case numbers.
Yeah. Absolutely. Well, and science has also shown that when you get to these numbers that are growing and growing and are so massive, sometimes it's hard for us as humans to wrap our heads around. So the one number I will give, this was also in tonight's CDC update, they're saying that Omicron is about 3 times more infectious than Delta. But when we talk about what that means for patients, there was a study out of the UK that shows that this Omicron version of the virus multiplies much more rapidly in the bronchial tubes, that's in your airway from your windpipe to your lungs, copies about 70 times faster in someone's body with Omicron than it did with Delta. What does that mean? Well, that's what's surging and causing this exponential growth. And while cases are mild, when we talk about hospitalizations, Rob, doctors and nurses are saying it doesn't matter, that they are still swamped and continue to be swamped. And when you look at hospitalizations, those numbers have gone up about 60% just over the past 2 weeks and are continue to expect to rise.